All right, are you ready for another patient question? This one I find to be one of the more frustrating things. So I see a lot of patients that have urinary symptoms that are similar to a UTI or bladder infection. And they come in or they go to urgent care and they get a urinalysis and urine culture and they come back normal, which is very frustrating. They get a lot of gaslighting like, well, you came in for a symptom, we did the test is negative, you don't have UTI, goodbye. Which is very frustrating. So what I need you to know is urinary symptoms like urinary urgency, going to the bathroom more frequently, even sometimes discomfort of the bladder is not always a UTI. In fact, it can be bladder pain syndrome, which is a very misdiagnosed and underdiagnosed syndrome that causes increased urinary frequency and urgency symptoms and pain of the bladder and urethra. It can also be the genitourinary syndrome of menopause. So again, during that perimenopause-menopause transition, a decline in estrogen causes urinary urgency and frequency. So those are two other reasons to feel symptoms of your bladder that are not a UTI. And just to complicate the matters, urinary cultures are not 100%. So sometimes there actually is something going on, but our diagnostic testing isn't sensitive enough to pick it up. So just because you've had a negative culture doesn't mean necessarily 100% that you do not have a UTI, though they are pretty darn good. Just remember, there's two other major syndromes that have similar symptoms to UTI, and if you really feel like you do have a UTI and you have that classic pain with urination, urgency, frequency, feeling like you always have to pee despite, emptying your bladder. So I hope this helps.